Welcome to our latest Hippocratic Adventures interview. I am Dr. Shwini Bapat, and today we are very excited to have Dr. Julia Rubin-Smith with us. She is a pediatrician who trained in Israel and the United States. She has practiced in several countries, including Liberia, Sierra Leone, Rwanda, Tanzania, Sri Lanka, Bangladesh, Peru. She most recently worked on a joint WHO Albanian Institute of Public Health vaccine effectiveness study. Let's learn more. Dr. Julia Rubin-Smith, thank you so much for joining us.
Thanks so much for having me.
So tell us your story. How did you end up practicing in, is it 8 different countries?
Yeah, sure. I would say I took a little bit of maybe more circuitous route to medicine than maybe some others. So I actually started out in public health, and I worked in public health for many years in global public health specifically, and did my master's degree in public health back in 2007, I think is when I got it, and was working in the field for several years and loved it. And I will say that kind of from an academic perspective, public health is really still my first love. But felt that I wanted to also be doing some more hands-on clinical work. And so I made the decision then to go on to medical school to combine clinical medicine with public health. And so I started med school at 30, was the third oldest person in my class, and knew I wanted to continue working in global health. So that was really helpful in terms of, already having a path that I had decided on. And so went to the Medical School for International Health, which is actually a specifically global health focused medical school in Israel.
Wow.
Yeah. And I actually found out about it from an American physician when I was working in Sierra Leone. And I was telling her that I was thinking about going to medical school. And she said, well, you have to look into this school that I went to. Yeah. And that was MSAH. And I had never heard of it before. And so I looked into it and I thought, this is a perfect fit for me. This is exactly what I want to do. And so I, packed up my life and I moved to Israel, which is where it's located, and did med school there. And then came back to the US for residency. And I did my pediatrics residency at the University of Minnesota, which also has a very, very strong global health program. So there was that thread that was through it kind of the whole time. And so a lot of the countries that you named in the beginning that I worked in, I was actually working in my capacity as a public health professional, and then didn't really start obviously doing the clinical medicine until after I had done med school and residency, and then in my current jobs as well.
Got it. So it sounds like you really started out more so in public health and then transitioned to medical school and then clinical care after that.
Exactly. And I think some people think of medicine and public health as different fields entirely. And for me, they're really just a continuum. I don't think you can really have one without the other.
That's true.
And so for me, they're really just, I do both now. And I think they're really intricately intertwined for me.
Very cool. So how did you approach, even when you were doing public health before you went to med school and then after med school, after residency, how did you approach finding opportunities in these countries or in the realm of public health?
Yeah, that's a great question. So I think so much about it is just, not being shy about kind of contacting anybody that you can possibly think of who might be able to connect you with the next person you can possibly think of. I think a lot of us, especially women, maybe are a little bit more hesitant to kind of just reach out there and cold call or cold email somebody that you don't know and just, say, this is what I'm interested in. And, do you have anything that I might be able to help with? And so for me, I had to get used to doing that. And now I'm much more comfortable with it. But, I think my first project, actually my first project before grad school even, I don't think you can really do it this way anymore, but I actually decided that I can't remember if I decided I wanted to go to Peru first, or I just decided I wanted to go somewhere. And I actually found a list of NGOs in the back of a Lonely Planet guidebook. And I just contacted them and I said, hey, I have some time.
Yeah.
One of them said, great, come volunteer with us. And, that was my first foray into it. I don't know if it really works that way anymore. It was, a while ago.
Yeah.
But that was my kind of first foray into it. And then once I was more kind of officially in the field, doing grad school and everything, it was a little bit easier because I had professors and I had, colleagues that I could contact and say, hey, I see you're doing this interesting work. I'd love to be involved. Do you have the space for me? Do you have work that you need done? And really being willing to do kind of, no job is too small, right?
Right.
You have to be willing to do anything if you want to get into the field and learn, because it's in the beginning, well, always it's all about learning, no matter how far you into your career.
And then, so even after, did you do any sort of global health in residency as well, or
I
during
did,
residency?
yeah, I did. So the University of Minnesota has a really, really strong global health program, specifically in pediatrics and med
Mm.
peds. They're really well developed. And so you can actually take more time than I think in most residency programs, with a few exceptions, to do
Mm.
field work, to do funded field work. So you still get your salary as a resident while you're abroad, which is not the case in every program.
Mm.
And the University of Minnesota has several field sites that they actually have kind of long-term developed relationships with. And so you can go somewhere else if you can develop that relationship and kind of convince the faculty and everyone that there's a reason why you should go to this new place and not some place they have established. But they also have several really well-established collaborations in the field. And so I spent 2 months in Tanzania when I was, as part of my residency program at the end of my residency, doing clinical medicine and public health work as well. So that was sort of built into the program. But for people who are programs that are less well developed in global health, you might have to do more of the legwork yourself.
Got it. And then how did you find the most recent opportunity in Albania? I know you were there pretty
Sure.
recently.
Yeah. So Albania was a very different experience for me. Most of my work has been in sub-Saharan Africa, especially, and then also some in South Asia and Latin America. And so Europe and Southeast Europe was a totally a new field for me. And it actually came up just because of the job that I have right now as global health faculty at Boston Children's.
Got it.
So our program manager had some connections with the WHO and specifically WHO Euro. And I'm not 100% sure how it came about, but I know that she had been discussing with them some work that they were doing. And essentially they asked if we could, help out as an academic partner in supporting research they had going on there on COVID vaccine effectiveness among healthcare workers. And so basically through my job, they sent me there for a little while and I was able to support the project. And we actually have 2 other faculty members that I essentially share the project with. We've kind of been rotating in and out and keeping in touch and supporting as best we can with the project. So that's how that one happened. It sort of fell into my lap a little bit.
Yeah, that's awesome. And that was more on the research side, it sounds like, not as
Exactly. Yeah.
clinical.
So that
Okay.
was not clinical medicine. Yep. It was supporting research that they're doing.
Got it. And when you worked in Tanzania, I guess during residency, what was I think you mentioned that was clinical work. Can you tell us a little bit more about what that experience was like?
Sure. Yep, absolutely. So we have a really strong collaboration in Tanzania with a couple of different hospitals. One of them is more of a kind of semi-urban tertiary care center that is in Arusha, Tanzania. So it's up kind of in the Kilimanjaro area. And we have an American physician who actually is from Minnesota, and he moved his whole family out to Tanzania maybe 6 or 7 years ago now. They live there permanently, and he has really helped to develop specifically a NICU in that hospital that they're continuing to develop. And then I was there a lot of the time, essentially just in the NICU, helping to take care of the infants there. And they're doing really, really amazing work there. And then there was another much more rural hospital that we also spent time at as well, where they have, fewer resources, as is often the case in rural areas. And I sort of rotated back and forth between the 2 of them. It was supervised to an extent, but of course it was the end of my residency. So I was at the point of more or less practicing independently in the US as well. And I think that's really important. And I want to mention that especially when physicians and other health professionals are working in, what we consider kind of less developed or less resourced areas, that we have to be super careful that we are not doing work that's out of our scope that wouldn't be ethical for us to do in a place like the US or the UK or other parts of Europe, for example, or Australia. That I think that happens a lot. And I think we have to be mindful of the work that we're doing and that we're being responsible.
Yeah, I think that's absolutely true. And what about your work in, I'm going to just go through some of the other countries,
Sure.
in, I guess, I'll just start from the top, Liberia.
Yeah, Liberia was a really interesting experience. I was actually there with MSF, Doctors Without Borders.
Oh, so you worked with MSF
I did.
prior to med school, it sounds like.
It was MSF won't take people until they're done with training. So right, it's circuitous, right? I said. So it was actually after residency. So when I graduated residency, I decided that I wanted to join MSF for a time.
Wow.
And that was a good time to do it because you sort of have to wait until they have a project for you, and then they propose a mission to you, and then they send you. And so it's a more difficult to do that if you're mid-career, because you have to kind of drop everything and go. So for me, I had the luxury of, I had just finished residency. I had a little bit of time where I could, study, take my boards, and wait for them to call me up. Right. And so, so I waited a few months, and then, they proposed Liberia to me based on my skills and based on the needs that they had at the time. And so I was there at an MSF-run pediatric hospital in the capital, sort of the outskirts of the capital of Monrovia, and I was the primary pediatrician there. It's a almost 100-bed hospital, so I was there for 6 months on a mission. Yeah.
Wow. And then what took you to Sierra Leone?
So Sierra Leone was not clinical medicine. So that was back when I was working in public health, and actually that was a really interesting project as well. It was the principal investigator of the study. She may or may not still be working there, but she had been running a longitudinal study that started in 2002, and essentially was looking at former child soldiers who had been essentially conscripted into the civil war there. And her focus primarily had been on mental health, social integration, that kind of thing. And so she had an observational longitudinal study starting in 2002, went back in 2004, and then I went back in 2008 to run the third wave of the study, essentially looking at, these former child soldiers who, by the time I went, most of them were young adults, and, some had managed to come out of the war and come back into society and do really well for themselves and start families, and from a mental health perspective, be pretty functional. And some really did very poorly, and had really a lot of issues with their mental health and their social integration. And so our main purpose was to look at, what's the difference between, these kids. It can't just be their own kind of inner resilience, right? There must be some modifiable factor that we can look at that potentially could be, used in a support program that can help them to have better outcomes. And so that was the project that I was working on there.
Very cool. And so what were some of the modifiable factors that you found?
That's a great question. Yeah, that's a great question. So it turns out that a lot of it is social support. Yeah. So a lot of it is how well they are accepted back into their communities, how well their community supports them. And it turns out that's really the thing about resilience, right? Very little of it is actually your own internal factors. A lot of it is your community and how well you're supported by them. And unfortunately, I think a lot of the kind of bad actors who conscript children know this, and that's one of the reasons that they cut kids off from their families, is that they know, and often will force them to either see or do things that will permanently cut them off from their communities, because they know that's essentially how they keep them. And so we do find that evidence does show that having those strong community supports and acceptance and reintegration back into the community is a really significant protective factor.
That's incredible. And then Rwanda, you made your way over to Rwanda.
Yes, Rwanda. Rwanda, I have a very, very soft place in my heart for Rwanda. It's for a time I considered it my second home. I haven't been there for a little while, and I miss it very much. But I went there first when I was in grad school. So in between the first and second year of the master's program, everyone does a field project, like kind of a capstone project. And so I went there for a couple of months to really just essentially work with an NGO based in the capital in Kigali. And that was something that I got through a professor of mine who I went up to him at the end of class and I said, I see you're working in this country and I really want to go. And he put me in touch with someone else he knew, and, it kind of snowballed into that. And so I worked there for a couple of months, essentially just supporting whatever work was needed at this NGO that worked with women who are positive for HIV. I think most of them as a result of violence during the genocide there. So it worked with them in a number of ways, medical care and other things. And then after I finished grad school, my master's degree, my thesis advisor had been wanting to start a project in Rwanda, and she knew that I had had some experience there, and so she essentially hired me. That was my first job out of grad school, was to work with her on work that she was then doing in Rwanda. And so it's all, it all is connected, right? And so then I went back to Rwanda multiple times over the next 3 or 4 years, working this time in a more rural area. And that was still working in the field of HIV, but this time children with HIV, and looking at again, it was a mental health related thing. So looking at kids who were affected by HIV, generally speaking, either they were infected or more frequently as parents who were infected or who had died from AIDS and HIV related complications, and looking at, again, kind of community acceptance, resilience, how to support these kids from a mental health perspective, which is at the time something I think that wasn't really being recognized as much in global health as a priority, and thankfully over the past, I think, 10 years is being recognized much more as something that is really in need.
And then you made your way over to Sri Lanka.
We're doing a little world tour.
It is a little world tour. World tour with Dr. Julia Rubin-Smith.
Right. So Sri Lanka was a phenomenal experience. So that actually was during med school. And so one of the things that was so wonderful about my med school, and one of the reasons I chose it, was that everybody in their 4th year does a 2-month global health rotation. It's expected of you.
Wow.
So,
okay.
Just you can go ahead and do it and do your best. It's you will do this. And they have sites in the US too, because of course global health is everywhere. But the vast majority of us went to a number of sites that they had set up where they also have longitudinal relationships. And you can see a pattern there of having longitudinal relationships, I think is generally the way to go from an ethical standpoint. And so we had a collaboration with a medical school in Anuradhapura in Sri Lanka. And so essentially I went with 3 other colleagues, and we just joined essentially the Sri Lankan medical students, and we rotated with them for 2 months. And it was great because we got the medical education they were getting. We got to be really integrated into that class. We made a lot of really, really great friends there who were just, they were really accepting and wonderful to us. And so that was a fantastic experience. And then one of my classmates that I went with also had a degree in public health and had worked in public health before med school. And so she and I had a lot of experience in public health, to the extent that one of the faculty members at the med school said, "Oh, good, I'm doing a study on leptospirosis, and I need you to help me do it." And so in addition to the clinical rotations, the 2 of us also helped him with that study that he was doing.
Oh, that's so cool to actually integrate with that 4th year class, or the med school class that you joined, because that's pretty unique. Usually a lot of people will go even during med school to do some sort of clinical rotation and not necessarily integrate with the local medical school and the students there. So that's quite unique.
It was really a fantastic experience. I really loved it.
And then you made your way over to Bangladesh.
Yes. So Bangladesh was actually a much shorter period. That was only about a month, and that was actually also during grad school. So where I went to the Harvard School of Public Health, I don't know if they still do this, but at the time they had something called J-term, which is essentially the winter session January term in between first and second semester. And so they have these kind of short-term courses a lot of people do during this winter session. And so our department was running a winter session course in Bangladesh that a number of us went on. And it essentially was sort of a field study and exchange with students, grad students there. And so we spent time at BRAC, which is the Bangladesh Rural Advancement Committee, which you may have heard of. It's I think the largest NGO in the world, maybe, who do a lot of work in public health and development. So we spent a lot of time with them, and then also a little bit of time with ICDDRB, which is the Center for Diarrheal Disease Research, Bangladesh. And so they do a lot of work with cholera. And so we spent a little time at their hospital too. And primarily that trip was more of a learning trip for me, and not so much, I would say I probably wasn't contributing that much or her knowledge. It was much more of a study and learn period. And that was really, really interesting place to be as well.
And so in your current position, it sounds like you have an academic position currently at Boston Children's. Correct. Is global health part of it? Is that where you do you take your academic time and do a lot of global health projects? Or?
Yes. Yeah. Great question. So it's a really, I think the way that it's set up, I think is really great. So I am global health faculty at Boston Children's. So really like the job is global health. But I also do clinical work as well. So part of my FTE is spent in the pediatric emergency department at one of our network hospitals. And the rest of my FTE is spent doing global health faculty work. So Albania was one of those projects. There are a number of other projects that we have going on where I'm either kind of, very involved in, like we're working on a project in Liberia with UNICEF. And that's one that I'm essentially the lead on for Boston Children's. And then there are other projects going on where I play more of a supporting role. But it's a great setup for me because it allows me to do global health as the work rather than trying to find little pockets here and there from another job where I can go off and do it on my own. And so I'm really lucky to have found that niche for myself where I can do that as my job.
And I guess within this position are a lot of the projects that you're pursuing outside the US, are they more policy based or more clinical, or how does that typically work with global health faculty?
Yeah, it's a great question. So I don't know that there is a typical for global health faculty. I think, we have a pretty well-developed global health program and lots of people doing lots of different work. So I can kind of only speak for my particular role because for everyone else it's going to be different. Mine is primarily focused on research. And so, and a lot of the research is sort of more on the public health end of things. So I know that there are other global health faculty and global health fellows that actually spend time abroad or at some of the kind of more under-resourced areas in the US doing specifically clinical medicine and supporting as clinical faculty. That's something I potentially will do in the future, but for now I'm focused primarily on research.
Got it. So what were the challenges that you encountered as you navigated kind of integrating into, at times, clinical care and at times research culture in all these very different countries, actually?
Yeah, sure. It's such a great question. Well, first of all, I can't say that I for sure have it all figured out or necessarily do it right every time.
Fair enough.
But I will say that I've learned a lot over the years in terms of just really remembering to, there's a lot of cultural challenges in terms of making sure that you are not kind of bursting in and causing trouble. I think the most important thing to remember is to help as much as possible and harm as little as possible. And so, or harm not at all if we can, although I don't know if that's possible. And so really, doing as much as you can to learn about the country ahead of time, learn about certain customs, learn about things that you shouldn't do because they might be offensive, things you shouldn't talk about, ways to dress, et cetera, et cetera. And so, I guess I wouldn't necessarily say that that was a challenge for me because I feel like I have been decently good about that from the beginning, but no matter how well you prepare, you're always going to run into cultural challenges and things maybe you don't understand so much. I think especially when I was working in public health earlier in my career and I was in my 20s, to be, a young woman who is, I'm not very imposing, I'm 5'3", to be working in some countries where I'm supposed to be the boss and almost everyone working for you is older than you, and many of them are men. And to figure out how to do the work and to do it effectively, be respectful, follow the cultural norms, but not so much that you can't get anything done. And so that's always, I think, a delicate dance. And, maybe somebody that's working for you or working with you is, not doing their job in exactly the way that you think is the most effective. How do you manage that without being disrespectful to someone who's older than you, and also not being the white Westerner coming in and saying, I know how to do this correctly and do what I tell you, because that's also inappropriate. So there's a lot of delicate navigating that I think has to be done that I, hopefully do right most of the time. Sure, sometimes I don't.
Fair enough. And what did you enjoy about your most recent stay in Albania? Because I think it was still, it was for this year, I think.
Yeah, it was just a couple of months ago. Yeah, it was pretty recent. So it was great. It was actually, because of COVID, of course, we have been grounded for more than a year, which is unusual for me. I usually travel several times in the year. So being kind of in the US, stuck here for a period of time was challenging. And Albania was my first trip out of the country for work, kind of coming out of the pandemic. And so, first of all, it was just great to be moving again and to be in the field again. So just grateful to be in another country and doing work that I find interesting and not having to do it all over Zoom and on the computer and actually being there in person, working with your team members on the ground was really, really gratifying. And just Albania is such an interesting country. It's, it's very different from a lot of places I've been. As I mentioned, Southeast Europe was a place I've traveled for, tourism, but haven't worked there. And so it was really interesting to learn how things work in this kind of somewhat different differently resourced context than what I'm used to. But I really, the team members were great. Everyone I worked with was fantastic, really friendly. They really welcomed me. They're really good at their jobs. The food is great. There's a lot of Italian influence. I ate a lot of
Really? In Albania? I guess it's kind of close, Mediterranean, I think.
Yeah, and it turns out there's a pretty strong historical connection between the two, and so there's a lot of food connection as well, and of course their own traditional food, which as a vegetarian I could only have a small amount of, but what I had was very good. But yeah, I just really enjoyed being there, and I spent a lot of time when I wasn't working just walking around the city and kind of seeing the sights and people watching, and it was really great. And I hope when things are more open, I'd like to go back and really spend more time actually seeing parts of the country that I didn't have an opportunity to travel to. But it was great to be out there again.
That's awesome. And for someone who is interested in global health and wants to have a career out of it, and who is looking for global health opportunities, what kind of advice would you give to them?
Yeah, this is a good question and also a hard question because you probably have sensed from some of the things I previously said that I think we have to be really, really careful, especially for coming from the West, what we consider the West, in how we approach this work. In public health and global medicine, we historically have done a lot of really good work, but also have a really tough history of colonialism and the damage that's done. And so I think it's really important to always be mindful when you're getting into this work, to always look at it through an ethical lens. So that's really, really important. I would any organization that you might want to go with, I would just research them really, really carefully, try to get a sense of the kind of work that they're doing. When you're new to this field, it might be a little bit harder to tell if somebody has, kind of the white savior complex, but just run from those organizations as far as you can, because you just don't want to be involved and you don't want to be perpetuating that. And so I would say, research really carefully any organization you want to be involved in. Make sure that they ethically line up with your morals and ethics. And then again, just contact as many people as you possibly can. It really comes down to making connections. So email people, call people. If you have an aunt who has a friend who, has a cousin who runs this organization, have them reach out for you, or get their contact information and reach out yourself. And you just have to not be scared to do it. And I think that's really the way to get involved, is to make as many connections as you possibly can. And eventually one of them will work.
And, I think this is actually really important because you talk about cold calling and cold emailing a lot. How many of those emails did you actually get responses to?
Great question. Probably half or fewer.
Okay. See, that's like super important to know, because
absolutely.
For
Don't
anyone,
be discouraged. Yeah, for sure. Just keep going. I will say you're more likely to get a response, and I find this now being on the receiving end of these messages, you're more likely to get a response if you have a very specific ask. And I think this is really important. I get a lot of emails from people basically saying, like, tell me what to do with my life. I can't help with that.
Right.
So I would like to help with that, but I just can't. And so I think it's much more helpful if you do some of the work ahead of time. Do a little bit of preparation, say, either I see that you're working on this project, I'm really interested in X, Y, and Z, is there a space for me to be a part of this team? Or, and it doesn't even have to be that specific. If you even have an area that you're interested in, or if you have a particular country that you'd like to go to, or, just something that's more specific and more actionable, because if it's too general, you're going to find that even if they want to help, it's honestly too much of a heavy lift on their end. And they're going to be much more willing and able to help if you show that you are willing to put in the work and are able to put in the work.
Got it. So, I mean, a lot that we've learned in this session, but I think one of the takeaways that I'm taking away from this is just two things. I mean, when it comes to any opportunity, actually, even outside of global health, cold calling, cold emailing can go a really long way. And then knowing that you're probably not going to get responses from the majority of people, so that's normal and that's okay. And also that when you ask something of someone, to do the preparation in advance of that email and try to be a little more specific. And All right, awesome.
Yeah,
And
exactly. One thing I just want to
yeah,
mention about the cold calling is that you're more likely to get a response if you have some connection. So even if it's
true.
just, so and so gave me your name,
Yeah,
rather than just out of the blue. It doesn't mean you won't get anything out of the blue, but really it's about making those connections and contacting anyone you can who might then have a connection to the next person. And even if it's I graduated from the same college, you know,
yeah,
and I don't know you otherwise, but here we are. So
right. That's wonderful. I think that's really excellent advice for anyone who is considering branching out or doing anything a little different. So Dr. Julia Rubin-Smith, thank you so much for joining us, and it was wonderful to chat with you. And to our viewers, until next time, remember, together we can dream beyond borders.